Let's talk ultrasound versus mammogram for breast cancer screening. And I just want to start out by saying they're not this versus that. The gold standard is mammogram, full stop. We add an ultrasound in some situations, but it should really never be either or. Now, ultrasound is good at finding early breast cancers, in particular women with dense breasts, which is why we recommend doing it with your mammogram. But here's some of the problems with ultrasound. Number one, it does not see those microcalcifications that are associated with the earliest breast cancers. And remember, the whole point of screening is finding those cancers early, because if you find them early, you're more likely to live through your treatment, but you also are more likely to have more choices in your treatment and have less treatment. So less likely to need a mastectomy versus a lumpectomy, less likely to need radiation, less likely to need chemotherapy. So finding cancers early is the goal because it's better for you as a patient, for you personally, but also for your survival. Now, the next thing about ultrasound is you're more likely to have false positives and biopsies that you don't need. So it's not one of these things we just want to throw into every single situation if we don't need to, because it does lead to procedures that aren't needed. And so just to review, it's not either or, it's always mammogram, potentially with an ultrasound. And that's for women in general with dense breasts. So if you are a woman with dense breasts, adding the ultrasound, you will find 2 to 3 cancers per 1,000 women screened that mammogram alone would have missed. Always important to remember the trade-off, though, is that adding those ultrasounds leads to more false positives and biopsies that you didn't really need.